As the director of the Governor's Office of Appalachia for Governor Kasich, I work with our local development district, Buckeye Hills.
We serve 8 counties in our region, and we have a population of about 260,000 people, very rural, medically underserved, not a lot of transportation options. I had attended an annual conference of the Development District Association of Appalachia. And during that conference, I had an opportunity to hear a presentation from the Department of Defense.
IRT is Innovative Readiness Training. This gives us an opportunity to work with the military who is training to deploy and serve our country, but also make an impact on Ohio's citizens, which is in a terrific need.
I heard about it and thought we needed to do this almost immediately. A lot of my 8 counties, there are a few of them that do not have a hospital. We had some that didn't even have an emergency room. So I knew that the medical services that could be provided would be invaluable to the residents in our communities.
About 2 years ago, year and a half ago, Misty came and talked about this grant to be able to get this medical mission. And just like the meeting back in 07, 08, it's like, we got to do this thing. We got to do everything we can to try to make this happen. And she's done a great job. Buckeye Hills has done a great job.
We're excited that people who haven't been to a doctor or a dentist in a long time will have a chance to come and see somebody just to get general stuff taken care of.
A lot of people think when they hear the word free that free means cheap or not worth anything, and that's why they're giving it away to us. But I can guarantee you have some of the best top-notch professionals here working hand in hand with the military to provide our community with the services that we need.
We can't say enough about the volunteers. It's civic organizations, it's church groups, there are high school students.
The volunteers were incredible. We had all age ranges of volunteers. We had veterans from the American Legion, the DAV, the VFW.
And I think a lot of people here really want to help in any way they can. You can look to your neighbor for help, and I think this is really proof of that.
School's out, so I decided to volunteer. There are so many families in need, not only in Meigs County, Athens County, all the surrounding areas. It's going to be wonderful, especially they've got 9 dentists here. All you have to do is come down and sign up and go through the program.
In times of need, we're going to be able to reach back out to these people and call on them, and they're going to line up to help.
It's a partnership between everybody. Every one of our clinicians are committed to giving the highest quality care here in a rural or a remote setting, not in a traditional hospital setting.
We put together the numbers to show the military that yes, if they came to Ohio and they came to my portion of Ohio, that they would indeed have the opportunity to see a lot of people and provide a service and receive good training. And when we had talked to some of the military that actually had put these IRT missions on in other places, they're like, tomorrow there's going to be a line out the door. When you get here in the morning at 6 o'clock, it's going to be standing room only. I hope people are ready for this. And we arrived the next day, and we got there an hour early, and we started the coffee, and we were all excited, and the military is moving around, and the volunteers are getting trained, and no one was there. And we waited. We waited.
I expected to pull up to the IRT at 20:07 in the morning, see people lined out the door. There were 3 or 4. And we're looking at each other like, where are the people? Second day, it was essentially the same.
We had a meeting, and they decided that they were going to institute shifts for their military personnel because there was a lot of downtime, and it's supposed to be a training mission, so they're looking at real world situations. All I could think in my mind was, we don't have the numbers there.
The 3rd day, the numbers started picking up.
I get a text from Mindy that says 85, and it's only 9 o'clock in the morning. I knew we'd only seen 100 people total the last 2 days from 8 a.m. to 4 p.m. So then I get another text, and it's 112. And I get a photo, there's a line out the door, and it was wonderful. I felt good for my staff and the volunteers mainly, because the military, they can adapt, but the staff had been working on this for 2 years, And we really had high hopes for how this was going to come together and what we were going to be able to do for our community.
We are hearing stories of people who they're having medical issues that are being discovered that wouldn't have been discovered otherwise. And at the end of your trip through the mission, if something is discovered, they're right there at checkout to line you up and make referrals to see that you're following up with a primary care physician or a dentist or somebody that's going to see your wellness continue once you leave here.
Our goal was not to just treat them and street them, but to educate them throughout the process and then connect them with community resources through the checkout process to make sure that they had the tools and the information they needed to move forward.
Those that are involved from the community are definitely here to be a presence and a part of people's health going forward. It does entail a medical provider, whether that be a doctor, a nurse practitioner, or a physician assistant. But it also involves many of the organizations and the services that are available here that we can connect people to.
You know, it's been nice to be able to give that education piece and hopefully set them up for a future of better health and not just, you know, a quick eye exam so they can get glasses. Because yes, that's a quick fix, but I want these people to be, you know, set up for the long term.
It's the patient stories really what I'm excited about. I drove here 100 miles and to get this taken care of because I heard that you're going to help me. Thank you for getting my glasses. Thank you. You know, no one's ever helped me with that issue before. Thank you so much, and to see the smiles on their face as they leave.
But there were times that we would tear up because it was so emotional that we were able to help these people. There was a young girl that had come from Florida. Her mother sent her up here to be with her grandmother, and she had braces on.
There were some issues getting medical records and things like that, and the braces were cutting her mouth, in the back of her mouth.
Just in checkout, we were talking, and I told her the problem I'd been having with finding an orthodontist that would take a transfer braces patient. And just with telling the story to Major Paul, it stuck in her mind, and she dug through a bunch of paperwork today to call me back because she had talked to the orthodontist here, and he was willing to take a look and see what he could do.
I talked to him about the situation, and he told me he could help me. And if I could find her, or if she comes back through, to bring her to him.
So we were able to get the wires off and then able to get her hooked up to a community resource.
They went the extra mile for sure.
Within 10 days, we brought over $700,000 worth of services to this area. And then you add the value of the volunteer hours that were provided to this county. Over $77,000 is the value of those volunteer services that we had. That's a huge impact on the economics of Meigs County, especially when it has such a deep impact on their lives with the services that they received. They had better vision, they got their teeth fixed. I would challenge any hospital emergency department to see 2,952 people in 10 days and have a 99.3% patient satisfaction rate. It was incredible. The numbers are all people, and all of those people have stories.
I see a lot of things, and I've lived in Meigs County all my life, and we've never had something like a medical mission to come to service the people here. So.
Optometry patients, we saw 703 and made over 600 pairs of glasses. There were 644 dental patients, but there were over 4,000 procedures performed. Pharmacy actually served 343 people. We ended up seeing 646 people and providing behavioral health services. And veterinary patients, over 900 animals were treated. They were spayed, neutered, distemper, and rabies shots. So we served a lot of people. People from 61 towns, from 20 different counties. We served people from the age range of 2 to 91, so it was a broad spectrum of patients that were served.
Oh, this little thing that started with 2 people and a piece of paper is going to affect thousands of people in this, not just Meigs County, the whole tri-state area.
So I don't think we really know the impact that we're going to have on people's lives long term. I believe it's going to be spectacular and wonderful. But when I looked back after the mission was over and I saw all of the volunteers gathered around and the elected officials, along with the Department of Defense, our active military men and women that serve so diligently every day. I realized, you know, we all came together to do this, not out of the result of a disaster or a man-made event, but we came together to proactively serve the communities that we live in and that we love.